Dear doctor, are credit cards priceless for you or do they pose a bit of a risk? Post the pandemic, since 2021, the number of credit card users and transactions made via credit cards has increased 20% year on year. Often we receive queries by doctors because patients keep asking to make payments via credit cards. Doctors wonder what is the right way or right approach to do that in their relative clinics or small nursing homes. And here's something to help you with that. Primarily, credit cards are accepted, which is known as a POS, point of sale machine, in which you can swipe a credit card, that is using the strip, or using the chip dip the credit card, or tap, that is via NFC, receive payments from the pay. Patients want to use these credit cards for paying heavy bills like dermatological procedures, minor surgical procedures, vaccinations. There is a definite advantage to the patients to use this as a payment method, and of course not counting reward points. But is there an advantage to the doctor? Is there a cost to the doctor to receive this? Let's understand that better. These machines tend to cost, there is a one-time fee which many providers do waive off, but it may either come at the cost of a longer turnaround and settlement cycle. Instead of 2 days, the money might be credited into your bank account in 15 days. Then there is usually a monthly subscription charge or maintenance fee levied by these providers for these very machines. And of course, then you have to train your staff to handle one of them. The main providers for these machines are HDFC Bank, Pine Labs, ICICI Bank, M-Swipe, Paytm, and many others who offer a good machine. But is there a way where you can offer credit card payments without a machine? Yes. There are payment links or credit card based QR codes that can be generated from payment gateway providers such as Razorpay and PhonePe, where the monthly subscription cost is taken away and you don't invest in a machine. You simply send a link to the patient and they can enter their credit card details and pay. But in both of these methods, one thing that remains common is the MDR charge, which the doctor or the person who's receiving the money has to bear. This is usually 1.5 to 2% of the transaction and can go as high as 3% for cards such as American Express, Amex, DCB, Diners Club and other international cards. So, as doctor, you may not be comfortable passing on that charge as a convenience fee to the patient. That's a decision that you need to make. What is the total number of transactions that you are seeing in a month? How many patients want to pay and what's the value that you might be losing? That would help you decide if credit cards are going to be a value addition to your clinic or another nuisance problem.